the last video. We'll have more cases and more notes. Some bullet points for your exam. And here's a case for you. Please pause. Okay, this is a male, pain in my face, right eye, right temple. Describe the pain as stabbing, piercing, accompanied by right eye tearing and droopy right eyelid. And it is 10 out of 10. Oh, this is the suicide headache. What is this? Cluster headache. How do you treat cluster headache? Of those options, 100% oxygen is the acute management. When I say abortive therapy, it means acute management while the patient is having the headache. Another case, please pause. So this is a 40-year-old male, unable to swallow, muscle weakness. He shows some signs of upper motor neuron lesions and other signs of lower motor neuron lesions, but the sensation is fine. What is this? This is ALS, amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. How do you treat it? There is no cure for it. The only option that we have is riluzole. It does not stop the progression of the disease. It just might improve survival a little bit and delay the need for tracheostomy and mechanical ventilation. This slide is huge because it summarizes everything for you. You are not allowed to forget the dopamine pathways. These are the different mood disorders, a lovely adrenergic fiber, and a cholinergic fiber. These are drugs with disulfiram-like action. They act as disulfiram, which is antabuse, which inhibits the acetaldehyde dehydrogenase. This will lead to accumulation of the aldehyde, and the patient will hate himself when he drinks alcohol. These drugs are metronidazole, chlorpropamide, and griseofulvin. If you're taking any of these drugs, do not drink alcohol. Serotonin syndrome is very important. You need to know that the glutamate is excitatory, but the NMDA receptor is attached to a GABA neuron, which is inhibitory. All of these drugs inhibit the NMDA glutamate receptor. They include felbamate, ketamine, methadone, PCP, dextromethorphan, memantine, and riluzole. Stimulation of these serotonin receptors will lead to these findings. Antihistaminics, especially first generation, such as diphenhydramine, can lead to sedation and weight gain. Many drugs are anticholinergics, and they are here. If I'm anticholinergic, I'm atropine-like, so red as beet, blind as bad, hot. You know the rest of the story, right? Or you can say the 3 C's: coma, convulsions, cardiotoxicity. These are the bad combinations. Do not do it. More terrible combinations: fibromyalgia management. Treatment of diabetic neuropathy and postherpetic neuralgia is almost identical. Let's differentiate among some drugs that sound similar: buprenorphine, butorphanol, bupropion, and buspirone. Buprenorphine sounds like morphine. It's an opiate. Butorphanol, it's also an opiate. It's an agonist-antagonist. Bupropion increases the release and decreases the uptake of dopamine and norepinephrine, leading to increased dopamine and norepinephrine. We can use it to treat depression and smoking cessation. If you have a patient who is depressed and wants to stop smoking at the same time, bupropion is your friend. But be careful because it can increase risk of seizures. If the patient had a seizure disorder before, you need to try varenicline. Buspirone, it stimulates 5-HT1A. We use it for generalized anxiety disorder. The drugs that start with an F and look similar: flumazenil is the competitive inhibitor at the GABA. We use this for benzodiazepine overdose. Fomepizole inhibits alcohol dehydrogenase. We use it for alcoholism. Fluphenazine is typical antipsychotic, and it inhibits the D2 dopamine receptor. Fentanyl is an opiate, very strong. Fondaparinux is an anticoagulant. It inhibits factor 10A. Formaldehyde is a disinfectant and tissue fixative. Fluoxetine inhibits reuptake of 5-HT. Flucytosine is antifungal. Flucytosine will become 5-FU. FU back. These are the drugs that can cause gingival hyperplasia. And here is a list of the pro-drugs that you need to know. What's a pro-drug? Something, when you give it to me, it's not very active. But once it enters my body, it gets metabolized into the very active component. Case in point, phosphonatoin becomes phenytoin. L-dopa becomes dopamine, etc. These drugs are partial agonists. Let's talk about cytochrome P450. It's located at the endoplasmic reticulum. It's microsomal. That's why the old name was liver microsomal enzyme. You find them in the liver and other locations. They are proteins, because the enzymes are proteins, contain heme, and they require oxygen and ADPH. 6 enzymes that metabolize these drugs. What are these enzymes? 3A4, 2D6, 1A2, 2C9, 2C19, and 2E1. Genetic polymorphism in poor metabolizers, intermediate metabolizers, extensive metabolizers, ultra. In other words, patients are different when it comes to this stuff. These are the most famous P450 inducers. You have to memorize these, and these are the P450 inhibitors. When we talked about selective serotonin reuptake inhibitor, they have interaction with the P450 system except citalopram. Factor 10A inhibitors also have the P450-3A4 interaction. Same thing with ketolides. These are antibiotics like macrolides. Same interaction. Here is a summary of all of the benzodiazepines, the barbiturates, Parkinson's drugs, even more Parkinson's drugs, typical and atypical antipsychotics, antidepressants, the opioids, Alzheimer's pharmacology, the mood stabilizers. We use these for bipolar disorder. General anesthetics, local anesthetics have two groups, and the neuromuscular blockers, CNS stimulants for ADHD, the anti-epileptic drugs, and last, the cannabinoids. These were the best lectures on CNS pharmacology on the face of the planet. I'm just joking. Let me know what you think. You can send me an email at medicosisperfectionalis@gmail.com. Thank you so much for downloading my course. Thank you for supporting this channel. It means the world to me. I love you. Take care. Be safe, stay happy, and study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense. If you like this course, more courses are available at my website, or you can watch my YouTube channel for free. Peace.